Bismillahirrahmanirrahim. I'm Dr. Nadia Awais. Today we are going to discuss contraceptions. Contraception is prevention of pregnancy by methods other than abstinence from coitus. The characteristics of ideal contraception include that it should be highly effective, independent of intercourse, rapidly reversible, low cost, widely spread available, acceptable to the religion and culture, and administration by health personnel is not required. Failure rate of a contraception is assessed by number of the pregnancies each year among 100 women using that method. The contraceptive methods are of two types. Reversible contraceptive methods, they can be short term, they can be long term. The short term include natural methods, barrier, combined oral contraceptive pills, progesterone only pills. Long term methods include intrauterine devices, patches, injectables, subdermal implants. The picture presents different type of contraceptive measures which you can offer to your patients. Irreversible methods are the long-term methods and they cannot be revert back to the normality. They are irreversible method. They are permanent method that include female sterilization in form of laparoscopic sterilization, hysteroscopic sterilization by using a particular sort of object called issue. The male sterilization include vasectomy. Natural methods include rhythm method. It is based on the detection of ovulation by using menstrual calendar, measuring basal body temperature. There would be a rise of 0.2 to 0.4 degrees centigrade after ovulation. Spinnerheit Test Personal ovulation prediction kit. You can use it at home. The failure rate is about 2.8 per 100 women a year. Quaternary interruptus is the oldest contraceptive method. Withdrawal in time before ejaculation, ensuring that all sperms are deposited outside vagina. Barrier method includes male condom, female condom, vaginal sponges, and their mechanism of action include physically interrupting progress of sperm in female genital tract. The failure rate is a bit high, that is 5 to 21 per 100 women year. It has the advantage that it is very effective against protection for sexually transmitted diseases and the cervical neoplasias. The contraindication include latex allergy. Combined oral contraceptions, it include oral contraceptive pills, transdermal patches, injectables, and vaginal rings. Combined oral contraception include two hormones, synthetic estrogen, progestrogens, and they can be present in different concentration in different type of contraceptive pills like ethyl estradiol, norethestrones, gestrodine, desogestrel, norgestamine, etc. Mechanism of action of combined hormonal contraceptives include inhibition of ovulation by inhibiting FSH, preventing follicular ripening, preventing LH surge, altering endometrium, altering cervical mucus, altering tubal motility, and impairing sperm migration, inhibit ovum transport. The failure rate is 0.3 to 8 per 100 women year. Characteristics of combined oral contraceptive additional to their contraception are that they prevent ectopic pregnancy, ovarian cyst formation, endometriosis, pelvic inflammatory disease, endometrial carcinoma by 20%, ovarian carcinoma by 50%, and benign breast diseases. So this is an additional benefit of the patients who are using combined oral contraceptions, that they would have a prevention against all these mentioned pathologies. Side effect can be minor or major, starting from depression, headache, nausea, vomiting, nostalgia, greasy skin. They usually improve by 3 to 6 months of use. Major side effects include cardiovascular accidents, venous thromboembolisms, MI, strokes, malignant diseases like breast and cervical CA. Contraindication of combined oral contraception can be absolute by cardiovascular accident, liver diseases, trophoblastic disease, undiagnosed PV bleedings, pulmonary hypertension, stroke, liver tumor, gallstone, porphyrias, and inherited or acquired thrombophilias. Relative contraindications include undiagnosed oligomenorrhea, smoking at age more than 35 years, diabetes, non-focal migraine, sickle cell disease, inflammatory bowel disease. Contraceptive patches with the name of EVRA are transdermal patches. They contain ethyl estradiol and norelgestroamine. And weekly patch, you have to use one patch every week, and after 3 weeks there would be a patch free week. The side effects are the same as the other combined hormonal contraceptions. Along with that, local skin reaction can occur. Combined hormonal injectables include Lunel with the name of cyclophem. They are comprised of depomedoxyprogesterone acetate, ethyl estradiol, and monthly intramuscular injection vaginal ring with the name of Nova. It also contains ethyl estradiol and etonorgestrel. Progesterone only contraception, again they are available in form of pill, intrauterine device as the name of Mirena, injectable subdermal implants. Their mechanism of action would be by inhibition of ovulation, modifying mid-cycle surge of LH, diminish ovarian hormone, produce endometrial changes unfavorable for implantation, and thicken cervical mucus for the sperm transport inhibition and inhibit sperm action. Progesterone only pills lower in efficacy than combined hormonal contraceptive pill because of their half-life lower, as they have a 15 to 19 hours half-life, and they can be used in patients who are on breastfeeding, older women, patients who have cardiovascular risk and diabetes. Disadvantage is that it causes irregular vaginal bleeding, functional ovarian cyst formation, and increased risk of ectopic pregnancy. Contraindication include undiagnosed vaginal bleeding, current history of severe cardiovascular disease, acute porphyria, hepatic adenoma, untreated breast carcinoma, trophoblastic disease, concurrent enzyme-inducing drugs, ectopic pregnancy in young nulliparous women. Injectable contraception include depomedoxyprogesterone acetate and net-in monthly injections, cycloprovera, progestins, etc., with a failure rate of 0.3 pregnancies per 100 women year. Contraindication to DMPA is ischemic heart disease, cardiovascular accidents, severe chest pain, shortness of breath, uncontrolled hypertension, diabetes, and diabetes with neurovascular complication. Subdermal implant with the name of Nexplanon and containing progestogen, etonorgestrel 68 mg. It releases 25 to 30 microgram progesterone on daily basis, and it is effective for 3 years. It is one of the very effective long-term reversible contraceptive methods. It has a very low failure rate of 0.1 pregnancy per 100 women year. They have advantage. It is very effective, long-term, reversible, and the fertility returns soon after its removal. Does not need motivation. You have to have a health professional dependence. That is the disadvantage of this method. Intrauterine contraceptive devices can be inert, which are no longer available, copper-based or hormonal releasing intrauterine devices with the name of Mirena. The copper-based surface determine effectiveness and active life of the device. It is licensed for 5 to 10 years. Its mechanism of action, it acts as a foreign body reaction in the endometrium, increase prostaglandin production, leukocyte infiltration, inhibits sperm transport, alteration of endometrial and tubal fluid, impairs the viability of gametes. Failure rate is less than 0.5 per 100 women year. The hormonal method is Mirena. Again, the mechanism of action that It acts as a foreign body reaction, liver digester called endometrial suppression. Its atrophy, alter the cervical and tubal fluids, impair sperm migration. It carries liver gestrel in it and 20 microgram progesterone disease per 24 hours over about 5 years. Its advantages are reduces anemia, license to use for menorrhagia. Disadvantages that there is a high incidence of irregular vaginal bleeding following its insertion, but usually this problem settles after 3 to 6 months of the use. Emergency contraception. Any drug or device used after intercourse within 72 hours to prevent pregnancy is called emergency contraception. Their mechanism of action is prevent ovulation, luteinizes, interferes with implantation. As we know, the chances of pregnancy due to unprotected coitus in second and third week of menstrual cycle is 8%. Emergency contraception reduces it to 1 to 2%. There are different type of contraceptive methods which are available depending upon the time period within which they are effective, and their efficacy is different according to the time they are used. Liver digester prostinor timings within 72 hours, 85% efficacy. And the mifepristol is an agent which is a single dose used, and it has 100% efficacy if used within 72 hours. Copper intrauterine contraceptive device, it can be used within 5 days of unprotected sexual intercourse. It has 99% efficacy. The mechanism of action of copper intrauterine contraceptive device that it prevents implantation, but it has a side effect that it can cause ectopic pregnancy. Allopurinol acetate is a 3 mg tablet containing allopurinol acetate, selective progesterone receptor modulator, used between 72 to 120 hours. It inhibits ovulation, endometrial changes, contraindicated in pregnancy or suspected pregnancy. So this is the presentation to give you a knowledge regarding contraceptions, and you can have a fair understanding when you go through your text much more about contraception. Thank you this for all today. The only thing I need to you people to know about contraception is that you should have a fair idea about the selection of contraception. Like an patient comes to you, you should take the detailed history of the patient so you can know the risk factor in your patient. Depending upon the age of the patient and the parity of the patient, you can offer the contraception according to their requirement. Suppose a young girl, if seeks contraception for a shorter period of time like 6 months to 1 year or even 2, she can have short-term contraceptive method. Suppose if she is having abnormal uterine bleeding, you can offer then combined oral contraceptive pills. If the patient is having the complaint of repeated sexually transmitted disease or vaginal discharges, pelvic infection, you can offer them barrier method of contraception. Same like if the patient have completed their family but they need some reversible method of contraception, you can offer them the long acting reversible method of contraception. Among them, you can offer then intrauterine contraceptive device as copper containing devices. If the patient would have anemia, if the patient is having heavy menstrual bleeding, then you can offer them Mirena as hormonal intrauterine contraceptive devices. You can also offer then implants if the patient is not comfortable with having a uterine device. So at the same time, if some patient comes to you and seek for permanent method of contraception, then you can offer them sterilization. There is a female sterilization method, there is a male sterilization method, but what you need to tell them clearly that these are permanent method. Their reversal is related to complication, because the permanent method of contraception, they would need the surgical method of treatment. Either laparoscopically, the patient can have certain complication which can be regarding complications of anesthesia. If the patient get pregnant after having female sterilization, then she can ended up with the ectopic pregnancy. She can have slipped clip, and she can have complication during the laparoscopic procedure, damage to the surrounding viscera. At the same time, keep one thing in mind, that if you are going to use the hysteroscopic guided permanent method of sterilization, which involves issue that is a spring-like object you introduce through hysteroscope through the tubal ostia in the tubes. Its effectiveness needs at least 12 weeks, because during that time period the fibrosis occur around that spring-like object in the tubes. So 3 months are required for the complete effectiveness of this procedure. The last is the male sterilization, that is vasectomy. After the vasectomy is done, then you need a specimen of husband semen at 12 weeks post procedure, so it should be sperm free sample. That is for all today. Thank you very much.